The coronavirus has impacted our lives in ways we've never imagined. And for women undergoing IVF treatments, it added a new hurdle. But as Michelle Imparato reports, there's new hope for patients this week as IVF centers slowly get back to business.
When elective procedures were stopped in Florida, couples struggling to conceive saw their plans for a family put on hold. Now, under phase 1 to reopen Florida, in vitro fertilization can resume.
The Florida governor has allowed us to start doing procedures that are non-urgent. But once again, we are resuming slowly and carefully.
And Dr. Mark Trolice with the IVF Center in Winter Park says that's for good reason.
We don't want to open up the floodgates and then just change the curve, spike it again, and we've done nothing but pause. We want to continue to mitigate risk, and the way we do that is that we're limiting the numbers of patients that are coming into our office. We're limiting the numbers of cycles that we're doing, and particularly we're prioritizing patients, those with cancer that need an emergency egg retrieval, those with severe ovarian aging that have a time sensitive biologically, as well as some insurance financial pressing matters that make it urgent.
There's also still little known about how coronavirus affects pregnancy.
So what we know right now is that pregnant women do not seem more susceptible to the virus. They really seem that they can get it like anyone else. We also know that there is some evidence to suggest preterm labor higher risks. Certainly fever in the first trimester could result in birth defects. You know, when this came out, Michelle, we learned about it in December in China and in February in this country. These babies haven't been delivered, so we don't know the effects of this virus on first trimester, which is so important as the baby's forming.
Setbacks or delays in the IVF process can often be devastating and weigh heavily on patients. But Dr. Trolice says it's important to stay positive.
We are going to overcome this. You're going to resume your cycles. And we also have our own reproductive health psychologist, and this is a time when they could reach out and talk to anybody that they feel that they need to talk to get through this, and we will together.
Michelle Imparato, WESH 2 News.